Regarding eligibility, federal guidelines have established that women between the ages of 40 and 64 years old that are at or below the federal poverty level of 250% are eligible for this program. It's also noteworthy that in the United States, there's about 11.1% women that are eligible for this program, but only 6.5% actually utilize it. Deaths from cervical and breast cancer could be reduced amongst the high-risk populations if they're more aware of the program to help with early detection and screening. Now, as clinicians, it's important for us to help our female population who qualify for this program to be aware of it and to access it. What is also important to know is that if any risk factors are detected for cancer, whether breast cancer or cervical cancer, the program also helps with continuity of care for further testing and screening with any kind of necessary specialty care and follow-up that goes on from there.
The Nevada Division of Public and Behavioral Health receives funding from the Centers for Disease Control and Prevention to conduct the Women's Health Connection program. The goal of the program is to reduce breast and cervical cancer morbidity and mortality among medically underserved women. And since 1997, Women's Health Connection has provided breast and cervical cancer screenings to over 50,000 women in Nevada.
I'm Melissa Madera and I'm with the Women's Health Connection. The Women's Health Connection pays for women 40 to 49 years of age to receive their annual breast exam, that's a clinical breast exam, their Pap test. Every 3 years or every 5 years they can have a Pap test with the HPV co-test. And women ages 50 and above can receive an annual screening mammogram along with a clinical breast exam and a pelvic exam with the Pap test. Pap tests are every 3 years. Pap testing with HPV co-testing occurs every 5 years. Who's eligible for Women's Health Connection? Nevada women who are at or below 250% of the federal poverty level who are uninsured or underinsured. Underinsured means their insurance company does not pay for breast or cervical cancer screening or diagnostic services. For women to enroll into our program, they have two options. Women who are seen at federally qualified health centers, local health authorities, or community health nurses may enroll at their provider's office. Women who see private providers need to contact the Access to Healthcare Network. For women to contact the Access to Healthcare Network to become enrolled into the Women's Health Connection program, they may call the toll-free helpline at 1-877-385-2345 and se habla español.
My name is Lily Helzer. I am the Comprehensive Cancer Control Coordinator for the state of Nevada. I'd just like to take this opportunity to talk about NRS 457. 457 establishes a system for mandated reporting on all cancer cases in Nevada. You may wonder why we have this system of mandated reporting in Nevada. You reporting into the Cancer Registry helps us guide all of our cancer control efforts for the future. One of the activities that we do is we establish a 5-year cancer plan for all cancer control activities. The data to guide this plan comes straight from the registry. The registry involves all incidence, mortality, years of potential life lost, really the true burden of cancer and the cost to Nevada and its citizens. So please update yourself on the regulations for 457 and help us get the data in.